This is Shelley Kraft coming to you live on SNNLive. We're coming to you live from the second annual Growth Capital Expo in Las Vegas 2015. I have with me Larry Gerrans from Sanovas. It's a private company. Larry, welcome to SNNLive.
Good to be here. Delighted. Thanks, Shelley.
It's good to have you. Let's get right into it. Let's get an overview on Sanovas.
Sure. Sanovas is a pulmonary disease technology company and a minimally invasive surgical instrumentation and medical device company.
So what differentiates you from everything else out in the market?
So we've fundamentally advanced the miniaturization of small diameter technologies for going places and spaces in the pulmonary anatomy and other places in the body where we have heretofore not been able to go because of the lack of small diameter technology and lack of sophisticated interventional tools. So we're making smart catheters, surgical cameras, small diameter surgical cameras, drug delivery technologies, diagnostics.
So you're starting in the lungs, is that it?
Yeah, the company was inspired to go into the lungs to create technologies to treat and cure pulmonary diseases such as lung cancer, COPD, emphysema.
So you're potentially replacing some both old and costly equipment, aren't you?
Yeah, we are. And by virtue of the pursuit of creating small diameter technologies to go to places and spaces in the pulmonary anatomy, we have created some manifest improvements of the current technology.
So what's the adoption rate in the marketplace?
Well, it's pretty swift. We've got about 750 million addressable patients in the current minimally invasive surgical marketplace, largely comprised of Americans, Europeans, Canadians, and Japanese, and then rest of the world. But in the last 15, 20 years, we've seen the world's middle class grow to 3.1 billion. So we're about ready to see a 400% increase in the global patient population for advanced surgical technology.
So what's your background? I just want to throw that in.
Yeah, so I came up through the ranks of DePuy Orthopedics, Johnson & Johnson, Stryker.
So when you started with this idea and encouraging the staff to continue to produce it, what was the backstory of where this idea came from of the entire company? And now, obviously, I want to expand upon beyond the lungs.
Sure. I think it all starts with the why. Really what we wanted to do was create a technology platform that was going to be able to help patients that were suffering from lung cancer and pulmonary disease. Regrettably, most patients heretofore have been palliatively medicated and sent home or sent to hospice. And we looked at that and said there's got to be a better way. There's a significant patient population out there that simply are not being treated effectively. And the reason is that technology has not been miniaturized sufficient to get to the places and spaces in the pulmonary anatomy that will allow patients or doctors to treat patients and to treat the anatomy there. So we really started with how do we change the tide in pulmonary disease treatment and create an interventional pulmonology technology company that can provide doctors with what we call the AIM method, the technologies to access the airways, to image the airways, to measure the anatomy that's found there, and then therein you can then start to diagnose. And then from diagnosis you can provide therapeutics and treatments such as drug delivery technology. So we really developed kind of an iterative approach, and we really took our time. We measured twice, cut once, surrounded ourselves with the best minds and the best talents from the clinical establishment, and really took a hard look at what was required to help improve technology for the lungs.
Now, seems to me there's other organs that you're going to be putting your technology to use in. Would you like to address a couple of those?
Sure. Well, by virtue of the procedural risks and the technological limitations that we had to overcome in creating small diameter technology that was highly sophisticated, we have essentially improved upon the capability of other interventional technologies. So we can go into places in the urologic anatomy, the gynecologic anatomy, the vasculature, the neurovasculature, ENT, GI tract. So by virtue of necessity is the mother of all invention, right? And the necessity to go into the lungs to try to get out to these small alveolar, places that were about 1 millimeter in diameter, really forced us to overcome that challenge. And by virtue of that, we can now go into places in these other small diameter anatomy that we've never been able to get to.
Let's get your website out there for more information for our viewer audience.
Sure. Sanovas is www.sanovas.com.
Ladies and gentlemen, Larry Gerrans, Sanovas. It's a private company. I'm Shelley Kraft. This is SNN Live, and we're coming to you live from the second annual Growth Capital Expo in Las Vegas, 2015. Larry, thank you so much for coming on to SNN Live.
Delighted.
Thanks again. Thanks.